is Dr. Andrew Dannenberg. I am a former professor of medicine at Weill Cornell Medical College, where I was the founding director of the Cancer Center. I am here as a representative of Canary Oncoceutics, with a great passion for preventive medicine, preventive oncology, and am enjoying the opportunity to learn more about medicine and oncology in India. I think this conference is very important. It's state-of-the-art. It touches upon everything from molecular medicine to the use of targeted therapies to immuno-oncology, and it brings together different disciplines. Cross-disciplinary interactions lead to new ideas, new approaches, and a better tomorrow. So I think meetings such as this one are extremely important, and that is in fact why I am here. There is, as mentioned, a strong link between excess body fat and sedentary lifestyle and risk of breast cancer. So the combination of an increase in obesity worldwide and a reduction in physical activity may contribute to the high incidence of breast cancer. There is a direct connection between obesity and cancer. No less than 13 types of cancer have been associated with obesity. Said another way, obesity is associated with an increase of numerous types of cancer, ranging from postmenopausal hormone receptor positive breast cancer to adenocarcinoma of the esophagus to pancreas cancer. Some of the most common cancers are associated with obesity. In reference to the relationship between age and cancer, there is a very well-known positive relationship between aging and cancer. That is, older people are more likely to develop cancer than younger people. This is thought to be due to an accumulation of mutations over the course of time. Today, there is a strong interest in the relationship between senescent cells, which accumulate with aging, and cancer risk. There is also a relationship between age and cancer from a hereditary perspective. So those who have a heritable cause of cancer may develop cancer at a younger age. Major difference between treatments in the past and today relate to the use of cytotoxic chemotherapy in the past. And over the last recent years, we've seen the development first of targeted therapies, whereby specific mutations or DNA abnormalities are pinpointed and medicines are developed specifically for those DNA abnormalities. So that has been one major advance. And a second major advance in recent years, above and beyond the use of chemotherapy and targeted therapy, is the use of immuno-oncologic agents, and even more recently, the combination of the different treatments, tumors, to determine the best form of therapy. We use a variety of techniques. Historically, we use immunohistochemistry. We can use something called FISH analysis. More recently, we have turned to genomics and the ability to use next-generation sequencing to identify specific DNA abnormalities, and that in conjunction with targeted therapies, or that in conjunction with immuno-oncologic agents, has led to breakthroughs in treatment and clinical outcome. Canary offers an outstanding test. In addition to being as expansive by evaluating more than a greater number of genes than anybody else's test, to my knowledge. In addition to that, the turnaround time is very fast. The report is very easy and informative to use, both for doctor and patient, which I consider as a clinician to be very, very important. And cost, of course, is extremely important. And Canary does its best to work with patients, to work with clinicians, to optimize cost, in addition to providing the state-of-the-art next-generation sequencing test. In reference to women's health and breast cancer, I would say that there is an opportunity for precision prevention, and specifically in postmenopausal women who are told that they have a normal weight and not to worry. We have found that there are many normal weight women who actually have excess body fat, and that excess body fat puts them at greater risk for hormonally driven cancers, including breast and endometrial cancers, also an increased risk for cardiovascular disease. We have tests today to figure out when a normal weight postmenopausal woman has excess body fat, and we have new and effective weight loss agents that need to be tested in these women, with the goal being risk reduction. The opportunity is here, and it should be taken advantage of. Speaking in terms of precision prevention, where we have now shown that normal weight women who are postmenopausal, a high percentage of them actually have excess body fat. Let's argue the top third. Those women are at increased risk for hormonally driven cancers and heart disease. A cutting-edge research question is to make use of weight loss agents such as the GLP-1 receptor agonists, semaglutide-type molecules, determine whether or not in these so-called normal weight women we can stimulate a reduction in body fat, a change in biomarkers that we know inform on cancer risk. That's what needs to be done next. The medicines are available. We know how to look. The study needs to be done.